facial rejuvenation is in several different categories, ranging from skin treatments, which are the basis of everything. It's the critical part of maintaining the health and quality of your skin, and can make big differences in the surface part. But you end up with the other component is the extra skin. I use the bedspread analogy as a good one for that, is that the surgical things, if you've got a messed up bed, straightens out the folds in the bedspread. But the surface, the treatments, the skin treatments will take care of the material. No matter how hard you pull on the bedspread, you can't change the fabric. You can't change the fabric. And so the skin treatments help do that. The surgery just gets out the folds. And there's a big difference in those two. Typically, the surgical or a traditional facelift is a two-layered treatment that will bring the face back up where it used to be, to treat the jowls and under the neck, to get rid of things hanging below the chin. And been the same for decades. The basic structure of it is the same because there's really not much way to get around taking care of those components. There's a lot of different nuances and different small things, and they're called a lot of different things, but the basic components of a facelift are the same. And the incisions are well hidden. They're back in the hair and behind the ear, and we can hide them well so that they're not seen. And as long as there's not an attempt to tighten too much or overcorrect, it can be very, very invisible, so to speak, so that people wouldn't know exactly what's happened. There are smaller versions, mini lifts and neck lifts and different things, but typical is much more unusual for those to really be the right procedure. They're used and marketed in big markets, in big city markets, because it's attractive and gets people in the office. But typically, if you look closely at the small print, it says these patients may have had other procedures. They probably had a real facelift. And so that's the mainstay of the surgical correction. It incorporates some liposuction with it that takes care of extra fat, and then a repositioning more than a pulling or tightening so much of the skin. It's just putting things back where they used to be. And so that is what I do. You don't try to treat the mouth inside this triangle with a facelift. That is a mistake that you see. If you see one that looks funny, that's what's happened, is they've tried a surgical correction of treating the mouth. And it generally never looks natural when they animate their face. And so inside here, you usually use fillers. Fillers are ways to treat the small wrinkles and smooth these areas around here. Is much more normal and natural look, and they can animate and smile and look good. And since fillers last for a year at a time or more now, that has been the miracle. That's a big improvement in what we can achieve these days with that. And so that's typically what we use inside here, and then we use the traditional facelift to take care of the loose or redundant skin here. And the incisions are behind. I put them behind the tragus on the ear, so you really, unless you're really looking and know what to look for, you can't really see it.